So here we would hypothetically have a broken forearm. Either one or both of the bones within the forearm are broken. And the first thing we need to do is assess the situation. Make sure there's no protruding bones, no blood, no major injuries. Then we need to get consent from the victim to do a splint. Do I have your permission to do the splint?
Yes, you have my permission.
We have gotten formal consent. We have on our gloves. The first thing we need to do is check for a pulse to make sure blood flow has not been cut off to the hand. And we do have a pulse, so we are okay. Then we will get an ace bandage. We will gently lift the person's arm up and begin to wrap the person's arm. That way we will have, when we do the splint, we will have no irritation to the injured body part, and it will be more comfortable for the victim. Now that we have our ace bandage on, we should still not be too tight to cut off circulation. Then when we get our modified splint, which is essentially just a magazine rolled up, we will place it underneath the arm. We will place the person's arm. It will go to the elbow, to the wrist, lined up with the palm. From there, we will get our cloth or makeshift tourniquet. Then we will tie it off, but not too tight, to make sure we do not cut off circulation. We'll make sure that the splint is stabilized onto the victim. Everything should not be too tight. We will check for sensation and the pulse again after we tie this off. It should not be too tight, like I said. You want to make sure you're talking to the victim. That way they know everything you're doing. They are calm, and you are calm. Everything should be in line. We will test for sensation. If they feel that. Do you feel that?
Yes.
Then we will check just to make sure we are not losing blood flow. It has returned to the normal skin color of the finger. Then we will check for a pulse again. We still have a pulse. Nothing should be too tight. The patient should not be in too much pain. Everything should be not ready to go. I will show you how the splint should look. You essentially want to have it lined up from the elbow, from the joint to joint. Make sure it is not too tight, but it's also stabilized. And from there, we will take the victim to the hospital for further treatment and for an official diagnosis from a doctor. Thank you. Oh wait, after assessing the victim and treating the victim, we need to dispose of our gloves properly, which would be into a biohazard bag or into a Ziploc bag and throw that away to make sure no contamination is onto you or to anyone else. Thank you.